Hi, my name is Amanda Price and I am the Endometriosis Women's Health Clinical Nurse Specialist for Powys Teaching Health Board. I just wanted to pop on and tell you that March is Endometriosis Action Month. Endometriosis occurs when tissue similar to that found inside the womb is found elsewhere in the body. Typically, it affects the ovaries, uterus, vagina, and can cause symptoms such as painful periods, pelvic pain, and sometimes difficulties getting pregnant. Some women have no symptoms, but it can affect 1 in 10 women and people who are assigned female at birth. Symptoms can start as young as 11 years old and around the time periods start. Sometimes symptoms can continue up to and after the menopause. Endometriosis Cymru state that around 70% of people who have endometriosis can have a relative with the condition. The Royal College of Obstetrics and Gynecologists estimate that 60% of teenagers and women will put off going to the GP with symptoms. They may think that it is not serious enough, that they may not be taken seriously, that painful periods could be normal and due to embarrassment. Please don't be embarrassed, we are here to help. The next podcast, I'll talk a bit more about symptoms and possible treatment options, but bye for now. Thanks for listening.